cognitive, rehab exercises or work would you do to then ingrain a person to be able to, step back, ask questions? Am I feeling something that's currently happening, or do I think it's happening? How do I address that, and how do I respond?
It makes me think of it with that one person in particular. He gets two things happen. He will get extremely distracted when he's working on cognitive remediation because he has all these other thoughts that he's thinking about. And so getting him to just focus on the cognitive remediation for an hour at a time sometimes is very challenging. And I have to remind him that, this is an area of weakness for him. Like, his cognitive skills have declined. So, and he doesn't like to hear that because he's a really bright guy. So I just have to remind him, gently, like, okay, remember, we're going to work on memory today because, at the last team meeting, we were all talking about, we had some concerns about your memory. We've all seen a bit of a struggle that you've been having. And so that's one of the things we're going to focus on. And he struggles with the fact that in our multidisciplinary meetings where the whole team is together, we discuss every case so that we each know, as we see each person, what they happen to be struggling with so that we each know what to work on. And he sees that as us talking about him. And I said, yes, we are talking about you in a positive way, just as we told you from the very first time I met with you that we would discuss your case as a team every week. And we will discuss that with you because you're part of our team. But he still really has a hard time with that. So he gets frustrated when he's doing cognitive remediation because he struggles to focus. And he tries to put the blame off on other things. So even during CogRem, we have to practice focusing the frustration with what's really frustrating him, which is his inability to focus, or his frustration that he's maybe not doing as well as he feels like he should on a particular game. And so, okay, client A, what would help with this particular game? What would help you with your frustration about your performance on this game? And he might struggle with an answer. And I was like, what if you went from level 7 to level 6 just to try it? And he was like, well, that would feel stupid. I would feel stupid because I had to go do something easier. And I was like, what if it was just a form of like taking a break? So he'll try it. He'll feel better. He'll get back up to level 7. He'll be doing better. And he'll be a level 8. And then it'll all be fine and it'll blow over. And then he'll thank me at the end of group for just giving him kind of a way to, a workaround.
Yeah. So it sounds like you're working through a self-esteem issue that's affecting his reception of the cognitive rehabilitation therapy.
Right. And then it helps him as well, because then I can say, when you're at home and you're really frustrated with the conversation you're having with your parents, you can use that same strategy if you just tell your parents, I need 5 minutes. Basically, just take yourself down from a level 7 to a level 6. Go to your bedroom for 5 minutes. Work things down to a level 6 and come back. And then you can talk to them. And maybe it's really important for you that they hear that you get to tell them what you're frustrated about. Can you just say, it's really important for me that I get to say what I'm frustrated about. Would you guys be okay if I told you that?
Yeah.
And maybe it's just how you word it, and they're probably fine hearing it, but it doesn't have to be an argument. And he was like, okay. So he actually tried it, and he was like, they actually were really receptive, and they said they would actually like to hear what I was upset about. And we had a good conversation. we didn't fight, and then we all had dinner together. And I was like, well, that sounds kind of like a win-win, actually. So I think I'm really proud of how you handled yourself. I think you did an awesome job.
That's amazing. Thank you so much for your time today. It was very lovely to have you talking about the program that you're providing for these people. It sounds like you're doing some awesome work at UT Southwestern. So thank you very much for your time.
Thanks so much.